Meet Jorge. Jorge works as a nurse educator in one of Alberta's pediatric cystic fibrosis clinics. He has 10 years of experience. The part of his job he likes best is finding ways to improve patient care and ensure the best outcomes for his patients and their families. We know Jorge as a nurse, but in today's healthcare system, Jorge is also a knowledge worker. So are Jorge's colleagues. So is Jorge's manager. And so are you. Think about it this way. Do you use your training, experience, and judgment to make decisions about what to do in your practice or programs? Do you need to seek out new and better ways of doing things? Do you help your coworkers learn and improve their practice by sharing what you know? Do you apply new information or adapt new practices to fit the circumstances? If you answered yes, then knowledge work, also known as knowledge management, is something you do daily as part of your job. In fact, effective management of information knowledge is key to doing business in AHS, and it's critical to the delivery of high-quality healthcare services. Let's look at an example from Jorge's nursing practice. Recently, he's been troubled by what happens when his adolescent patients are transitioned to adult care. Former patients have told him that when the time came, they felt kicked out of the pediatric system. The expectations of them and their families had changed, and they didn't feel prepared. In many cases, they felt that their care and health suffered as a result. Jorge wants to know, what can he do to improve the experience of his patients and their families during this transition? What happens next in Jorge's process? Let's break it down. Jorge is trying to solve a problem. He wants his patients and their families to feel prepared for transition and benefit from improved continuity of care. He asks the question, in young adults with cystic fibrosis, what actions support a successful transition to adult care in terms of patient experience and health outcomes? To answer this question, Jorge needs to gather and interpret the evidence. What have others done? What has been shown to work? As he assesses and interprets this evidence, Jorge will develop new knowledge. He'll be aware of the options that exist and fit that in with what he already knows and what else needs to be considered. Then, he'll use his accumulated knowledge to make a decision. What should he do? How will it be different than what he is doing now? That decision may lead to a change in practice, the actions that will help achieve the outcomes he wants. When making decisions, we all follow this process unconsciously, but sometimes we need help along the way, especially when it comes to seeking out and making sense of the evidence. So, what counts as evidence? Research is one important source, but there are other sources of evidence, such as Jorge's experience and that of his colleagues, what other hospitals or jurisdictions do and why they do it, measures of patient satisfaction, and clinical data and information. It can be tricky to gather and use the evidence we need to help us achieve our goals. What the evidence says about how to provide safe, high-quality care changes over time. In many cases, it changes so quickly that it's difficult to keep up to date. Practitioners like you and Jorge may have difficulty accessing all the available evidence. It can be time-consuming to gather, review, and interpret it. And sometimes, the evidence is non-existent, unclear, or conflicting. This can make it a challenge to improve or change practice. For example, mounting evidence over the past 15 years suggests that good transition planning is a cornerstone of effective care for young adults with chronic conditions. But a recent assessment of transition care in Canadian pediatric cystic fibrosis clinics reveals that only half use either a formal transition program or informal transition practices. That's a big gap. The problem is, if we don't seek, share, or apply evidence to make decisions or improve practice, there can be significant consequences. We waste precious time and resources, reinvent solutions to problems that have already been solved by others, or as we see in this example, our patients and families may be at risk of not benefiting from the best possible care, and in some cases they may even be at risk of harm. The good news is that it's possible to do things differently. In AHS, we're creating an environment where learning from evidence and applying that knowledge to practice is always how we do business, because our staff, physicians, and leaders are skilled knowledge workers who are committed to ongoing learning and improvement. They're able to use proven knowledge management processes and tools and technologies to effectively access and use evidence for decision-making that leads to best care. These are the pillars that support effective knowledge work in any organization. We'll use Jorge's practice question to explain. As a knowledge worker, Jorge is able to use different tools and strategies to build his knowledge. As a first step, he decides to take a look at the literature on best practices for transitioning youth to adult care. He uses the AHS Knowledge Resource Service website to do a search for some key research articles. All AHS staff have access to the resources and services provided by KRS. Go to krs.albertahealthservices.ca to find journals, books, and databases related to your own practice. Jorge also wants to learn more about what other organizations have done in this area. He talks to an AHS librarian who explains that he might find this kind of information in the grey literature. She shows him how to modify his search, and this leads him to a few resources that look helpful. But he's left with some questions about how some of the recommendations could be implemented in AHS. He decides to raise the subject at the next meeting of the community of practice he belongs to. Jorge's community of practice includes a dozen pediatric cystic fibrosis practitioners from across the province. They meet regularly to discuss practice questions and learn from each other's experiences. Before the meeting, he shares a couple of the resources he found by posting them to the discussion forum of the COP's online collaborative workspace. He gets responses from 2 colleagues who won't be able to attend this month. One sends a copy of a care pathway recently developed by their clinic to address the same problem. At their virtual COP meeting, he tells the group about his concerns and the evidence he's collected to date. It turns out that many in the group have been dealing with similar challenges, and in the ensuing discussion, his colleagues help him identify some actions that he can take as an individual clinician to improve the experience of his patients. We hope this example has showed you how the 4 pillars of knowledge management work together to improve healthcare. Jorge's story is just a snapshot. In our next episode, you'll learn about more knowledge management tools and processes that support the delivery of quality care to Albertans. In the meantime, if you'd like to learn more about how to use the practices or resources you heard about during this video, visit the Knowledge Management Department's website. Do a keyword search for knowledge management on Insight. Then, browse the available resources by expanding each of the categories listed on our homepage. You can also email us at km@ahs.ca if you have questions or wish to learn more. Thanks for listening.